This is the second video of a series of 3, and now we're going to show you how to assemble a self-aspirating local anesthetic syringe. We will be following the steps of the evaluation sheet that you need to know well because you will be also tested using that. So the first thing we have to do is we are going to sanitize our hands, wash our hands or sanitize our hands very well so that with clean hands we can follow the directions of the dentist. So this little paper that I'm choosing is the directions of the dentist for me to put together the anesthetic syringe. So he is requesting a carpule, a solution that is Septanest SP, and a needle that is 27 long. So I'm going to put this here so I can follow it. So first of all, let's grab the self-aspirating local anesthetic syringe, the one that has the flat end of the piston. We're going to put it right in here. The next thing we're going to do is we're going to choose the carpule or cartridge that is Septanest SP, and that's exactly what it says here, Septanest SP. One of the next things that we have to do is to take the correct anesthetic needle. So this is going to be 27 long, and the reason why I know it is because we have written down in here says 27 long. So we're going to put it in here. If I had a different size, I will be looking in the other containers. Next thing we need is going to be a gauze. It's 2 square gauze. And also we're going to need an alcohol swab. So we're going to put it right in here. And the last thing we need is a cotton tip applicator. And we're going to put a little bit of topical anesthetic, which is what the dentist will be using to apply in the mucosa of the patient before applying the anesthetic syringe. So we're going to be putting a little bit of it on the tip, not too much and not too little, so we don't want to have a lollipop. And we're going to place it right in here. So it looks to me that we're ready to start. So the next thing we have to do is position our safety glasses, which I have them on. Then we're going to proceed to sanitize our hands again. And after sanitizing our hands, we're going to be placing our examination gloves. So we're going to be doing that right now. Just ensure my hands are really dry, so placing my gloves is not going to be challenging. We're going to place the other one. And we're going to continue now with the steps of the evaluation sheet. So the first thing is we're going to assess that all the parts of the anesthetic syringe are going to be firm and nothing is going to be coming apart. There's nothing worse than passing an anesthetic or having ready an anesthetic syringe for the dentist that is coming apart. So the first thing we're going to check is the thumb ring to ensure that it's nice and firm. Then we're going to check the finger grip against the barrel, and it's nice and firm. Then we're going to check the end of the piston, nice and firm, and the needle adapter. Everything has to be nice and tight. So I know that this is ready to go. The next thing I'm going to be doing is I'm going to talk a little bit about the cartridge or carpule. So first of all is Septanest, which is the one, Septanest SP, the dentist was requesting, and we're going to ensure that the date, the expired date is going to be correct, that we can still use it. So it's 219 May. So that means that we are still okay to use it. Next thing we want to check is to ensure that the solution is clear and that there is no particulation or sediment, that there is no bigger bubble. Sometimes we can have a very small bubble. We're also going to check that the aluminum cap doesn't have any corrosion and the diaphragm doesn't look punctured. Everything looks good, and then I go to the other side of the carpule and we have the rubber plunger or rubber stopper or silicone stopper, and it can be intruded for 1 or 2 millimeters, no more than that, and it should not be extruded. So I'm good with it. The next thing I'm going to check is the needle. First of all, it's a 27 long. And I'm going to ensure that the seal is not broken. In this case, it's not broken. So we're going to put it in here, and now we're going to proceed to put together the anesthetic syringe. the first step is we're going to use a cotton swab, an alcohol swab, and we're going to be disinfecting that carpule or cartridge. First thing we do is that aluminum cap and the diaphragm, and then we're also going to disinfect that rubber stopper or silicone stopper or plunger. We're going to leave the alcohol swab here for a minute because we're going to use it for something else. And we are going to place this now in the anesthetic syringe. So we're going to open the space, hold it like this. We're going to seat the anesthetic syringe by the rubber stopper or plunger, and we're going to let it go. And it is nice. It's not going to come out in any way. So we're going to put it in there. Next thing we're going to do is we're going to break that seal of that needle, and we're going to loosen it, and very carefully, just with one hand, or we can help with two hands, but not putting our fingers close to the end part of the needle, because it is important to keep it very clean. We're going to grab our syringe. We're going to hold that cartridge firm. We're going to have a bit of a fulcrum, and in a very vertical fashion, we're going to place this inside the syringe so that we can engage with that part of the carpule, which is called the diaphragm. So this is nice and firm. Now this should be ready to go, except I don't know if this solution is going to flow or if there's any kind of defect. So I can't assume this is ready for the dentist. I need to test it first. So the first thing I'll do is I'm going to loosen the needle guard. We're going to let it fall, and then we're going to express a couple of drops, no more, in that alcohol swab. Now, if there's one that stays there, leave it there. Do not approximate it to anything in here, because you will be contaminating that needle. So the next thing I'm going to do is I'm going to place this needle guard, and with one hand I'm going to be putting it inside the needle guard, and I'm going to ensure that it's nice and firm, totally well put together. If the dentist is on this side, I will be placing it like this in the static zone, or to the other side if the dentist was in the other side. Now, this should stay here. If the dentist asks me, Maria, could you please pass me the anesthetic syringe? I will be saying it is ready for you in the static zone. Now, the last thing we're going to do is we're going to place the cotton swab with the topical anesthetic and the gauze, the 2x2 square gauze, in the tray where we have the instruments, and it's going to be ready, but it's not going to be on top of it, because we don't want to pass a gauze to the dentist that has already some topical when the intention is to dry the tissues. And the other thing we're going to be doing, because we don't need this anymore, is we're going to put in the little envelope that alcohol swab, and we're going to put it on the side. We will dispose of it after, and we're going to have everything ready. Thank you.